So Tina and I will be sharing with you our training for one-to-one paraprofessionals supporting students with autism in Surrey School District. We will start by touching on positive behavior support in schools and the need for additional training for those supporting students in Tier 3 of a PBS model. And the focus of our presentation will be the Behavior Technician Training Program, which we have implemented over the past 4 years, followed by a discussion of what we have learned during that time and a new direction for our training that we have taken in the current school year. Just as Dr. Stock kind of showed in his presentation earlier, school-wide positive behavior support, it really is a framework for establishing positive school culture and pro-social behavior. There are 3 levels or tiers of prevention. And I know that Dr. Miranda tomorrow will be going into a lot more detail, but just briefly, Tier 1 is called primary prevention, with all students receiving universal supports, and 80% of students will be successful at this level. Tier 2, or secondary prevention, is for additional targeted supports, and about 15% of students will be successful receiving Tier 1 and Tier 2. Tier 3, or tertiary prevention, is individualized support, and 5% of students will require this intensive level of support. So many of our students with autism and challenging behaviors will actually fall into the 3rd tier of support and are often assigned individual paraprofessionals or education assistants. I will clarify at the outset that although students at Tier 3 are expected to receive Tiers 1, 2, and 3, you can see it is additive. Sometimes that when you have a paraprofessional assigned, it may mean that that student may not be accessing all 3 tiers as they have that not targeted but individualized support in terms of a paraprofessional. It's also important to know that a paraprofessional should not be viewed as an intervention as just until themselves. Paraprofessionals can support interventions, but simply adding an adult into the classroom doesn't necessarily lead to improvements in students' behavior. So first of all, our educational model currently across North America for students with autism relies largely on paraprofessional support. And then as our population of students with autism rises, we can reasonably expect that the number of paraprofessionals in schools will also rise. In British Columbia, inclusion is our mandate in public education, and students with autism, especially those who are more affected by their autism, may receive the bulk of their educational instruction from a paraprofessional. So given this important role, there is actually a lack of consistency and considerable variation in the type of training that an education assistant may receive before they start working with students. And even in those cases, training and experience that they have received in the past may be a poor fit for their current students' needs. Fortunately, there is an abundance of research on the efficacy of techniques based on the ABA approach, or applied behavioral analysis, for individuals with autism. However, paraprofessionals in inclusive classrooms often continue to actually report a lack of training in areas of ABA and appropriate training for behavioral challenges in the classroom. So there is indeed an impetus for training in Surrey school districts, and I would say other school districts as well. In Surrey, individual positive behavior support plans, or PBS plans, are often and most developed by district behavior specialists such as Tina and myself. So for those students who have complex needs, many school teams actually struggle to implement key strategies to address problem behavior consistently. As mentioned, while paraprofessionals support an intervention, they shouldn't be viewed as an intervention into themselves, but as frontline workers, they are often the primary implementers of Tier 3 strategies and skills. So in Surrey schools, we found that EAs, or education assistants, do require an enhanced skill set in order to implement both proactive and planned support strategies with fidelity. According to the literature, to train large groups of paraprofessionals in an efficient fashion, school districts have historically relied on didactic or a lecture-style workshops and in-services that produce temporary behavior change at best. And as you know, currently we're in a workshop or a lecture-style format currently. We get excited about new ideas, but temporary or brief instruction and training leads to more brief change, if there is change, right? We get excited in the moment and we apply what we've learned, but how are we able to continue that? So in contrast, multi-component models with effective training components such as modeling and performance-based feedback appear to be successful in producing favorable gains for both trainee and target populations. So therefore, according to the literature, for a paraprofessional training program to be successful, it would have to include experiential-based learning, such as role play, in vivo modeling, and immediate feedback given on implementing behavioral strategies. So these were the discussions that we were having in Surrey School District in 2013. We recognized there was a need to increase our paraprofessionals' competencies in supporting challenging behaviors. And we also knew that to have a really sound training program, it would need to be comprehensive and engaging in multiple ways. Luckily, the BACB, or the Behavior Analyst Certification Board, released a set of standards for the new Registered Behavior Technician credential for frontline staff supporting children with behavioral needs. So this coursework is actually developed according to a task list that is set by the BACB and covers 6 skill domains: measurement, assessment, skills acquisition, behavior reduction, documentation and reporting, and professional conduct and scope of practice. So this was really actually important because it was the first time that the industry had set a standard for those experiences and trainings that a paraprofessional or a frontline worker should have when supporting someone with behavioral needs. So what does a registered behavior technician do? So it's a paraprofessional who practices under the supervision of a behavior analyst or an assistant behavior analyst. They are direct implementers of behavior plans. They collect data. They do some types of assessments. They do not design or design intervention plans or do assessment plans. They ultimately are working under a supervisor, and the supervisor is responsible for the work that they are doing. So the credential definitely held promise when we looked at it in 2013. We looked further into the requirements for the credential. The training has to cover all aspects of the task list. It has to be 40 hours in length with 3 hours that are devoted to ethics. It can either be lecture-based or experiential, but as we know from research, experiential learning would lead to better positive outcomes. Training can be either in person or online within a 180-day period. Initially, it was 90 days, and now it's actually 180 days. And that training has to be designed and conducted by a board-certified behavior analyst, or BCBA. So at the time, we had a BCBA, myself, in a position to create such a training program and deliver it in person, and so we decided to proceed with that. So while we could definitely meet all of those training requirements, it would prove challenging to have our education assistants be fully qualified RBTs, R being registered. So in addition to the 40 hours of training, there is a requirement for RBTs to pass a rigorous competency assessment. Initially, the competency assessment requires a direct observation of skills along with an interview, and later that interview was replaced by a standardized exam. And so there are really 2 reasons why our EAs, over the past 4 years, we haven't actually gone on to register as RBTs. The first is that there is a supervision requirement for registered behavior technicians, which is supervision by a behavior analyst every 2 weeks. And given that it's really just Tina and myself, and we have a very large school district, we simply wouldn't be able to meet this requirement, given that this training program is just one of the many things that we're actually responsible for doing in our jobs. Second is that in a union environment, there really is no incentive or any extra incentive for an education assistant to pay a yearly fee to a board like the BACB for a credential when their job doesn't actually require that they have it. So that's why our paraprofessionals that we have trained, we've said that they're EABT, they're education assistants with behavior technician training, but we don't call them RBTs. However, if any of them have, and some have inquired and perhaps have pursued outside of the school district work on home teams and in actual private behavior analysis, they can pursue it. They would just have to take the standardized exam and find a supervisor.